Hi everyone, we'll have a brief introduction into how to take care of your Belmont chair. In this particular case we have a Belmont Compass. Most of the chairs are very similar unless you have a Voyager, which might have a different type of unit, but we'll have a brief chat about that too. So a general rules of thumb is when it comes to cleaning the chair is that we do not want you to use alcohol, any harsh chemicals or bleach. Now that obviously leaves us only with alcohol-free wipes, but if you're using alcohol wipes, it's important to have the right wipe for it, which is either designed for the equipment itself. You can have a look on a Belmont website and they have their own products and their own care kit you can use to not to make any mistakes with a different brands. From experience myself, it's been proven that Cleano green and white package wipes do cause a corrosion to aluminium, which we have a fair bit on these particular chairs, so if you don't mind trying to stay away from those. Another important part of the wipes is we need to make sure that they are not too wet. So if you're using wipes which are dripping wet, that's usually a bad thing. Either drain as much moisture out of it so the wipe is moist rather than wet. That will save you down the line some issues with the chairs. A typical one would be any moving parts which contain grease to lubricate the joints, like here or there, and there are some on the spittoon and some on the unit, which can possibly cause a corrosion or simply dissolve the grease, which turns into oil, leaks out and stains the covers, and eventually the grease will disappear completely and the joint will seize and stop moving properly. So by draining as much moisture out of the wipes, that will help to prevent it and also stop the excessive rust to the moving parts. The next step, it would be our upholstery. Once again, the same rule applies. No harsh chemicals, no bleach, no alcohol. There are designated wipes and cleaners out there. You can either refer to the one supplied by Belmont, or there is also their product which is very good and very gentle with upholstery. Now, a particular place where we need to be really careful are the lights and light shields. This particular light is a LED light, so strictly speaking, no wipes should be used on the light itself. Two reasons: any excessive moisture can leak behind the shield and cause corrosion or shorten any electrical connections, and also a wipe would normally leaves smears, which are really difficult to get rid of. Particularly it will not block any focus of the light itself. It shouldn't really affect the intensity of the light, but unfortunately patient can see it and it doesn't look right. The best way of cleaning lights is using a non-alcohol spray and a linen-free cloth. Simply apply the spray to the cloth, never to the light. Wipe and clean the light with the non-alcohol solution. Turn the dry way and clean until dry. And that's the most gentle way of taking care of the light. The next part we'll be talking about is the spittoon. Now, this particular chair has 3 filters. One is inside of the spittoon bowl, which is our bowl strainer. Then next one is our suction filter. And the third one is our spittoon drain valve, which is over here. So there are a couple of rules to follow on cleaning the suction filters and other filters on our spittoon. Before removing the filter, make sure that you drain the spittoon drain valve, either using a remote switch or sometimes it's attached somewhere near the spittoon drain valve. So we'll press it and hold it, wait for the suction to turn on and drain it. Then we can safely remove the filter. It used to be an old-fashioned that we used to bleach our filters. We used to keep them in a solution for overnight, which unfortunately used to be mainly based. Cleaners would be bleach based. Unfortunately, with the bleach reacts with the plastics and they do become brittle over the time and can crack and no longer be efficient enough to be used as a filter. Now, the best way of cleaning the filters would be simply removing the filter, emptying the contents into clinical waste, and then you can either use a spray solution. In this case, I would suggest that you can use bleach cleaner. The best one out there I've used for years is a Flash, just a standard domestic cleaner with bleach. You spray on, use a toothbrush, soft brush, clean it. Now, the important part is to get rid of any traces of a bleach cleaner, rinse it, and all you need to do is place it back where it belongs. Because the filters don't get in contact with patients, it's enough just to clean it and make sure that everything there are not blocked. Any filters with a fabric mesh, strictly speaking, any damage to the mesh, the filter needs to be replaced. Also, when you're cleaning this part, use a very soft toothbrush and try to make sure that you're not damaging the fabric filter in any way. Also, for our spittoon drain valve, it's the same process in any other filters. Now, for taking the filters and the cups which seals the filters inside of the housing, they usually have O-ring on it. Now, the best way of taking care of the O-ring is, other than cleaning it, try to make sure that there is no dirt and no amalgam, which tends to be quite abrasive. Also reapplying a bit of a silicone grease. Now, this silicone grease can be purchased from simply companies like Amazon, as long as you make sure that the silicone is designed for O-rings and seals. So once again, just a silicone grease or silicone spray. You apply a little bit to the filter or seal or cup, wherever you want to use it, and then it makes it nice and easy and simple to reinsert back. Also, any housing of the filter needs to be cleaned. So after removing the filter from the filter housing, it's a good habit to run a wipe from inside of the filter housing. Make sure there are no traces of amalgam, once again, as it is quite abrasive. You can scratch the housing itself, and which then sustains more dirt. Make sure it's all nice and clean, and place the filters back in, and that would be taking care of your filters. The next tip would be taking care of your 3-in-1 syringes. Now, this particular model has two, one on the nurse's side, one on the dentist's side. The best practice to keep this as healthy as possible and for us to be able to service it, what happens sometimes, the excessive rust to the two parts of the syringe will stop us from servicing it properly. So where we need to get inside of the syringe, and this upper part, the actual body of the syringe, gets seized The reason why it's happening is because when you're wiping it with the wipes, some of that fluid or some of that cleaning solution gets sucked in between the handle and the insert of the 3-in-1 syringe and starts causing corrosion to the handle. That unfortunately will seize and does not allow us to remove the syringe and service it from inside properly. The best way of stopping that is that if you set yourself a 1 day in a month where you simply remove the syringe from one side and simply take the one from the nurse's side, remove it and swap them around. At this point, making sure that there is no aluminium oxide corrosion on any of the part. If there is any, try to clean as much as you can. And as I said before, swap the syringes around. In this case, you get the syringe an even use and both of them get evenly used. And also it will stop the corrosion progressing into the point where syringe gets seized and does not allow us to service it properly. When you're placing the main body of the syringe onto the insert, make sure that it gets twisted and the water and the air gets engaged. The first step we take in the morning when you're powering the chair up is to turning the main isolator for the power on. That might be placed on the wall as a switch or elsewhere in the cabinetry, on the cabinetry or the upstand of the worktop. Simply turn the power on and then we'll move to the next step of attaching the bottle and turning the air on to the chair. Now the importance of connecting the bottle correctly is filling it up with water as you would normally, attach the water bottle semi-tight, turn the unit on after it starts hissing slightly and turn until hissing stops. Never do more than that. Or a common mistake that the bottle gets tightened first and then the unit gets switched on. In that case, you never know how much torque you're applying to the water bottle, and then over the period of time will damage the bottle and then you have to replace it. So now when the unit is on, the only function for the nurse you need to know about is a flush or intensive cleaning or the purge. It has a different names. So what we're technically doing by applying a biofilm cleaner into your water, whatever products, there are many products out there. I would specifically recommend Alprum. To flush our outlets, what we need to do is press F button, F for function, 3 times. 1, 2, 3. Select either minus or plus, which shows on the display. Minus for handpieces only, and plus for handpieces and cup fill and bowl flush. If you press plus, it will take up to 5 minutes to do the flush, which we try to cut the time on it. So therefore only use the minus button and selecting only the handpieces. So once again, as the function has disappeared after a few seconds. 3 times press F button, select minus for handpieces only. This will take only 40 seconds. Pick up all your handpieces, all your handpiece hoses. Keep hold on to all the hoses in bunch. Place them over the spittoon or sink or a bucket, and then press the main foot pedal. And what happens after for 40 seconds with the countdown, the water will be purging out of the handpieces, flushing them through. Nothing else will happen, just the water coming out. At this point, if you need to stop the process, just press the pedal again and the process will stop at any point of this countdown for 40 seconds. Otherwise, just keep holding it for 40 seconds. After 40 seconds, it will stop, and then you can place all your handpiece hoses back into their holders. We all know that sometimes what happens on the suction hoses, after use, they develop a split on the suction hose just below the handpiece. Remove the suction valve with the fitting from the suction hose where it splits, just by simply twisting it and trying to break the glue off, or if the valve's already detached, easier for you. All you need to do, cut the damaged section off, and by using a super glue, ideally a flexible one like a gel from Loctite, apply a small amount to the fitting of the suction valve and simply reattach. Wait for it till it dries and place back.